It's the summer of reinfection.
Developed a fever, like 102, and exhaustion that I have never experienced.
Data shows more people are getting COVID even after being vaccinated and boosted. Talia Mendez is one of them.
I have to wait 3 months before I can get the 4th boost.
With each new subvariant, the battle to get control over COVID can feel more daunting, with many Americans wondering.
My thing is, well, when will it stop being on the rise? You just want it to end.
Nationwide, the CDC reports more than 124,000 new COVID cases per day. It's an increase of about 16% over the previous week, the highest daily infection average since mid-February. The Biden administration is urging Americans, particularly those age 50 and up, to stay current on their COVID vaccines. Sunday, White House COVID-19 coordinator Dr. Ashish Jha said the most immune-evasive subvariant is spreading rapidly throughout most of the country.
What that means in practical terms is that if you were infected 3-4 months ago, you can get reinfected. We're seeing high levels of reinfection. We're seeing people who are not up to date on their vaccines have a lot of breakthrough infections.
For high-risk individuals, experts recommend a second booster shot 4 months after the first. But with CDC data showing just 48% of Americans have received a first booster.
One of the key messages coming out of this moment is if you are 50 or over, and if you've not gotten a shot this year, in the year 2022, it is absolutely critical that you go out and get one now. It will offer a very high degree of protection.
Officials say a new booster shot specifically targeting COVID subvariants BA4 and BA5 is on the way. The FDA estimates Omicron-specific boosters from Pfizer and Moderna will be available this fall.
We have a ton of transmission right now.
Citing a spike in cases, health officials say LA County is on pace to reinstate its indoor mask mandate by the end of the month. And while Dr. Scott Gottlieb Sunday on CBS said he doesn't see much tolerance for mandates, there are certain settings where mask wearing is still recommended.
I think if you're going into a congregate setting with a lot of people you don't know, wearing a mask is prudent if you're in a high prevalence area, especially if you're someone who's at risk.
The White House said it will continue to ensure the availability of COVID vaccines, boosters, treatments, and testing to combat the disease and work to control the fast-spreading Omicron subvariant.